Thank you very much for joining me. My name is Chris Scattergood. I'm one of the co-founders of Fundamental VR. I'm going to do a brief discussion today around the use of VR in really accelerating the safe and compliant use of robotics, how we can use VR to drive awareness. These are difficult times where it's hard to actually get in front of customers and show them the power and the individuality of the robotic-assisted surgical devices. So I'll be talking about how we can use VR technology in our platform in order to enable that. So first of all, just to give you a little quick overview of ourselves as a company, Fundamental Surgery has been working in surgical training now for around 7 years. We are unique in that we have developed the capability to incorporate haptics. These haptics aren't always needed in robotic-assisted surgical devices, but we do see them as being key in the future of training surgery in general. It's a really important piece of technology. However, what we're aware of is whatever the technology is that you're using, whether it is a haptic device such as the one we're looking at on the screen here, or whether it's the slightly more scalable haptics, you can see a haptic glove here, of haptic gloves which are coming in the future, or indeed the ability to wear one of the many headsets that are launching onto the market that enable scalable use of virtual reality. Here you can see people joining a multi-user environment from around the world, all based from their own kitchens. So all of these technologies are important. They're all part of our blended virtual reality platform. And whichever one of these technologies you utilize for your training and education needs, then it's good to know that all of them pull back into a central data point. And that means you can have one holistic view of what your customers or your trainees are doing, which is important. So let's jump into it then and skip on from there. I think, as I mentioned in the brief introduction I did earlier, then there are a number of things about us that are worth sharing with you. We are the only virtual reality company who has been accredited as a surgical education center. So everything we do needs to meet the standards of the Royal College of Surgeons or any of our partners. So we're lucky enough to have the Mayo Clinic and Sana Clinic of Germany as two of our most significant investors, bringing us both money and also insights and tactical support in the development of solutions. As well as that, we're very proud to work with these brands that you can see on the side of your screen here, some of the most well-known and most advanced brands in technology and in medical device space. Looking at the spectrum of use cases then for virtual reality and how this can really help with what's happening with robotic-assisted surgical devices. One of the key things for us, we think, is the fact that in these current times, it's so hard to move the robots around the world. And people access is very difficult as well, whether that is just getting access to surgeons to show it them, or in the decision-making process, say, for example, in sales, you'll also want to have hospital administrators, senior management team, etc., all able to share an understanding of the benefit. So it's really key that we can utilize this technology that is available and has been accelerated in the last 18 months to bring the robot to your customers, all by simply shipping a low-cost virtual reality headset. So I'm going to run through some of those case studies that we talked about earlier. So this is something we're doing for one particular robotics company that we think is really exciting. I can't show the video of that itself right now, but I can give you an indication of how it works. So importantly, what we're able to do is just by shipping out a really simple headset like this, this can go anywhere in the world. It can be there in sort of 72 hours. And then people can put it on, connect to Wi-Fi, and they can join me in a virtual space where they can actually, as these people are doing on screen now, they can then actually see, it's like being in the same room. We can hear each other, pass tools together, walk around, operate equipment, move robotic arms. All of that is very powerful and very easy to achieve now. So you can start to help customers to perceive what it would be like to be in front of the actual robot, but just as importantly, to contextualize it into their own space, to show how it will fit into a small room, etc. And we think that is really powerful. In addition to that, we talked about the surgical team and being able to do that. And for a UK robotics company, we've developed the capability to do that. That's really powerful. So for those guys, what we've done is we've brought them the ability to set up their robot devices around the patient and to work together to link those robots using the appropriate wiring and to run through what would normally be done either in a paper-based manual or with on-screen learning, but to actually do it as a team, as if they're joining in a virtual space together. And that really is amazing and a real groundbreaking technology to use at a time like as we are now, where travel is somewhat limited in certain areas in particular. So that's been a project that we've been working on now for the last year. And eventually every robot from that company will ship with a device to teach their audience how to get the most positive value out of the robot itself. As well as being able to do this, the other thing that we think is important, and you see it very commonplace in the market, is the use of an off-robot trainer. So off-robot trainers are great. It means it frees up the ability to use the robot itself for actual practice or for rather procedures. And it gives you the ability, though, using virtual reality to practice and allows the surgeon to practice wherever they are, location independent. They don't have to be with the robot, of course. But what's really powerful is when they can join together. And I think it's when you join together, as per this example of a procedure that we've built here. This one happens to be in tibial nail, but it's using a C-arm and it's got the ability to manipulate this. So what you can see there is there's two surgeons. You can see on the right-hand side of the screen, a trainee, and then Mr. Omar Sabri, who's a senior consultant from the UK. And he's teaching the trainee how to get the most effective use of the C-arm and how to monitor the capability, or rather the patient's presentation, as you can see it on the screen there. And that's a really powerful thing to be able to do live from across the world. Mr. Sabri is actually based in Dubai at the moment, and he can still run that session. And that in itself is a powerful message. I'm sure you agree. So what's really great then about that kind of surgical enhancement is the ability to not only work with surgeons, with surgical training teams, but additionally to actually look at how can we help accelerate what's going on within the robotic companies. So it's very expensive, time consuming to bring a national sales force into a location or to bring them together to train them physically in how to best sell, operate, manipulate, and communicate the power of the robot. If you're bringing a group of people together, you have to schedule and coordinate timings, diaries, etc., and then pay large hotel bills. Hopefully all those people can attend and everybody can travel safely. If that becomes difficult, then virtual reality is a great adjunct to how you can actually accelerate that. So in this example that we see here, you can see the ability to bring in a high number of people. I think there's 40 odd people in this session that we ran here. And each one of those people can have practiced on their own in their kitchens and understood what the new features are, the ones that are relevant to their particular area. So there's no point learning about structural heart if you're working in the area of GI. You can learn your specific training points that you need to pick up on to help you communicate with your customers, or you can come into this one space and all work together to run through a didactic session and then jump off and go into actual breakout rooms where you can work on the robot itself. And it's this type of training that we're creating for a number of large brands at the moment, and we think is really powerful. It's a really great technology. There's a number of features that I think are important to anybody that's looking to get into VR or looking to select a VR partner. From our perspective, it needs to be somebody that's got dedicated life science or med device expertise. So we, for example, only work in this space. We don't work in automotive. We don't work in any other form of education. We're very focused on this. And that's reflected in the fact that we've actually got the Surgical Education Centre training accreditation that I mentioned earlier in the session. The technology that's really needed, and we found an important development in our early stages of working with robotics, was making sure that we could effectively and quickly simulate inverse kinematics. That took a while to develop that, to the point where now, as you're moving our clients' robot arms in our simulators, you actually perceive that you're holding it, and you have a perception of weight almost as you manipulate the robot arms around, which is a very powerful form of training. And I think that's something that whoever you choose to work with, it'd be key to get that and some customer testimonials so that you know you've got somebody that really knows what they're doing. Otherwise, it's quite a steep learning curve. Whatever you're doing in training, of course, needs to be measurable. You need data. You need to have facilities such as the ability to have one single login to be able to feed into your own learning management systems and be able to really integrate that education back into your businesses. And that's important. As well as that, we think that global deployment support is really important. So making sure that whoever you work with can deliver your simulation into any market, whether that's a localization. Of course, you wouldn't want to build a robotic trainer and find that you can't actually translate it into German or any European language. And then likewise, you want to make sure that you can actually physically deploy it or ship your headsets into the location that your customers are. So making sure you're culturally appropriate to those markets is important. And I guess finally, to wrap up then, looking at all four of those particular use cases that I shared this morning, then I think it's the clear thing from our perspective is making sure they all tie together so that everybody knows that what's going on, whether it's with your people, whether it's with your customers, or whether it's with your educators, and understanding everybody and where they are in their learning curve and how compliant, how safe, and how ready they are to share your message with their audience. So that's my presentation. So if anyone has any questions, I'd love to hopefully answer them for you.